Opposition, movement of the thumbs to touch the fingertips. Reposition, moving to its normal location. Flexion, decreasing the angle of the joint. Extension, increasing the angle of the joint. Straightening the joint. Dorsiflexion, backward flexion, raising your hand or foot. Plantar flexion, increasing the angle of the ankle joint. Elevation, moving a body part in a superior direction. Depression, moving a body part in an inferior position. Adduction, movement away from the midline. Adduction, movement toward the midline of the body. Circumduction, circular movement of a limb at the far end. Rotation, turning or revolving a part of the body around its longitudinal axis. Umbilical, central regional near the navel. Vertebral area of the spinal cord. Sacral, the posterior region between the hip bones. Scapular, scapula or shoulder blade area. Sternal is the breastbone area. Tarsal, pertaining to the ankle. Orbital, eye cavity. The patella is the front of the knee. The pelvic is the pelvis region. Cubital is the anterior surface of the elbow.
Axillary is the armpit. Brachial is the upper shoulder. Buccal is the cheek area. Calcaneal is the heel of the foot. Gluteal is the buttocks. Inguinal is the pertaining to the groin area. Lumbar is the back between the ribs and the hips. Nasal is pertaining to the nose. Occipital is back of the head. Alicarnal is the back of the elbow. Carpal is pertaining to the wrist. And sulfic is pertaining to near the head. Cervical is pertaining to the neck region. Coxal is pertaining to the hips. Digital is pertaining to the fingers or toes. Femoral is pertaining to the thigh. Ventral is the side of the belly. Dorsal is pertaining to the back. Anterior is pertaining towards the front. Posterior is the back. Inferior is lower body farther from the head. Superior is higher on the body, near the head. Medial is towards the midline of the body. Lateral is away from the midline of the body. Distal is away from the point of attachment. Proximal is closer to the point of attachment. Directional terms are terms used to explain where one body structure is in relation to another, or example, where fingers to our hands. Regional terms are anatomical terms that refer to a specific visible part of the surface of the body. Our example was a nose.